And my name is Erlisha Selders, and we are eye care specialists in the Southeast region of the East Baton Rouge Parish School System.
Our presenter this morning is Ms. Chantel Jacobs. Ms. Chantel specializes in treating individuals 16 years old and older with anxiety, depression, trauma, relationship issues, low self-esteem, grief, and spirituality issues across the state of Louisiana. Ms. Jacobs is a graduate of the University of Louisiana at Monroe with a Bachelor's of Art degree in psychology and a Master's of Art degree in psychological counseling from Nicholls State University. Ms. Jacobs is a licensed professional counselor, board-approved supervisor, and a psychology adjunct professor with 19 years of experience in the behavioral health field. Ms. Jacobs has been appointed by the Louisiana Department of Health to participate in the Adverse Childhood Experiences Educators Program, which consists of providing free training to the community about childhood-related trauma. Please refer to your eye care website for additional bio and contact information uh, on Mrs. Chantel. The question and answer session will take place at the end of the session. I now present to you Ms. Chantel Jacobs.
Good morning, everyone, and thank you, Ms. Ford, for that wonderful introduction. I am so happy to be here with you all. And so today we will be talking about adverse childhood experiences. So just give me just a moment so I can pull up my PowerPoint slide and share that with you all. One moment. And so, as I mentioned, we will be talking about adverse childhood experiences. And so, if you may not have heard of adverse childhood experiences, that's basically dealing with childhood trauma. And so, we'll be talking about the impact that that can have on you as you become an adult and looking at the physical effects, the emotional effects, and how it can affect one's overall well being. And so I'm going to go to our next slide here. And so I'm going to share with you just some findings about the Adverse Childhood Experience Study. And so we call it the ACE study. And so the ACE study actually confirms that with scientific evidence that adversity early in life can certainly increase one's physical, mental, and behavioral problems later in life. The ACE study is one of the largest of its kind, and it has over 17,000 participants. And so it was developed and also co-sponsored by Kaiser Permanente, which is a managed care insurance company of San Diego, California, and the Center for Disease Control and Prevention in Atlanta, Georgia in the early 1990s. Dr. Vincent Folletti and also Dr. Rob Anda are the co-principal investigators of the ACE study. Dr. Anda, who designed the ACE study while he was working as a senior scientist at the CDC, he actually reviewed and approved all of the information about the study that we will be going over today. So let's talk about the human nervous system. And so before we take a deep dive into what the components of the ACE study are, I want to explain a little bit about brain development. The human central nervous system connects us to ourselves, to other people, and to the world around us. And so the central nervous system, it consists of the brain and the spinal cord, and it all integrates into our senses and information from receptors that are located throughout our body, as you can see depicted on the slide. And so it's responsible for regulating those internal body functions, and it manages the elaborate chemical and electrical signaling. The nervous system, it considers those sensory inputs in the context of every second, and it determines our understanding of and the responses to the world that we live in. The cells in the nervous system are called neurons. And so they have this impact on our processing and transmitting information, and it has that central purpose of helping us adapt in the way that we live each and every day. And I would like to highlight also Dr. Martin Teichner of Harvard University. He has reviewed and approved all the brain science facts that we are talking about on today. So let's talk about synaptic density. And you may say, well, what is that? And so if you're looking on the far left of the screen here, you'll see that we see a set of brain cells or neurons and what it might look like at the particular time of birth. And so as you can see, there aren't that many connections between these cells at birth. And so babies are only born with those connections and brain functions that they need at that point in their life. Most of the wiring of our brain, it occurs as a result of life experiences through our senses. So by the age of 6, which is that elementary age, the brain cells now have many more connections. And so the wiring of the brain, or just the making of the complex neural networks, is what we call experience dependent. So what a person experiences the most, it tends to lead to very robust connections between the nerve cells that form networks. And so we call this process branching or arboration. And so the last section on the slide represents puberty around the age of 14. And so if you notice that there are now fewer connections between the brain cells than from the age of 6. And so this is because the least experienced connections tend to withdraw about the time of puberty. And so we call this process pruning. And so this phenomenon, it actually helps us to understand why when kids are neglected or they're not getting enough attention, love, and care, they tend to have disruptive behavioral problems, or they may have difficulty interacting with others. It may also impact their health or their social development with their peers. So as we know, everyone's life is unique. But just for the illustration, let's just imagine 2 different worlds. The world on the top is very mean and cold and dangerous. And then the world on the bottom is very kind and generous. Traumatic experiences during development, like abuse or neglect, chaotic relationships, can generate predictable patterns of brain architecture, behavior, and traits. So humans are only really made to be under stress for a certain amount of time. And it's actually 20 minutes at a time. And that's actually long enough for that fight or flight response. So experiences that cause stress chemicals can be produced, which can, like if a child has been abused or neglected, or if they've experienced being in a war zone, it can have an impact on their overall development because their bodies become wired to prepare for a constant world of danger. And so if we look at the bottom, that lower path we call the benevolent world. And so that world is considered to be kind and easygoing. It's helpful and it's free from traumatic stress. And so people growing up on that path are more likely to develop a brain with all the necessary cells and wiring and chemistry to help them stay focused and be flexible or relationship oriented. But those individuals at the top in that world of danger, those individuals tend to experience a lot of trauma early on in their life. And so their body produces a lot of stress hormones. And so those individuals can have certain characteristics like being edgy or hot-tempered, very impulsive or hypervigilant, being withdrawn or numb. And so oftentimes those kids may get singled out as being a behavior problem, being rebellious, refusing to follow instructions. But a lot of times we don't take enough time to figure out, well, what is actually happening to this particular child? Is it that they just refuse to listen? Or if we did a brain scan, what would their brain scan indicate? And so a lot of times these kids tend to be very self-focused. They could be labeled as being selfish. And that's only because if this is a kid that is constantly exposed to danger or traumatic events, they don't have time to consider other people or their feelings because they have to prepare for what may happen next. Will I come home and witness my mom being beat up by her spouse? Will police officers come and knock down my door again? Will I witness someone being murdered or shot? Will someone creep in my room again at night and molest me and violate me? Those are all of the things that people can be experiencing at that age, which can certainly put them on the edge and make them only focus on themselves. So what kind of situations do you think could be possibly a good match for a person who tends to be edgy, hypervigilant, emotionally detached, or even quick to act? And you could put your responses in the chat box if you're able to chat, but think about it. What kind of people may work certain types of jobs, right? So if you're quick to respond, as we can see from this picture depicted, we see a firefighter. Because if there's a fire and your house is burning down, you don't want someone that is going to be slow to respond or may have to think, okay, what do I need to do? No, you need someone that's going to get up, move, and respond in a quick way and put the fire out and save lives. And so some other professions that we may see would be a police officer, a person that may work for the FBI, the CIA, medical staff that work in the ER. All of those are positions where you have to move and respond very quickly. So one common belief in our society is that people whose experience takes them at that top path that we talked about earlier is considered to be maladaptive, and the people at the bottom are adaptive. But that's not true. Both brains can adapt according to the experience that they have. And so that's actually good for us as a species, because the people whose brains tend to adapt to, say, those dangerous and stressful environments are more likely to survive when life gets tough. And the people whose brains adapt to that safe world that we talked about, where it's kind and peaceful and supportive, those individuals are likely to meet society's expectations in very tranquil periods. And so according to this brain science information, it shows us that our experiences actually gets hardwired into our biology. So Dr. Teisner, he also indicates that when our biology collides with the social expectations, that oftentimes we can run into trouble. So say if you put a person from this benevolent world into a very chaotic and turbulent environment, it could be like riot control. That individual, they may struggle unless they've learned specific skills to handle those type of situations. And likewise, say a child that adapted to a dangerous, stressful world. It may be challenging for that person to sustain patience. That person may not share or cooperate. They may not use words to communicate. They may be accustomed to just responding, reacting. So when a child goes to school and we ask that child to sit still or share, cooperate, it could be very difficult for that child. And so in a lot of cases, we see that children have to be actively taught the appropriate skills required in order to succeed. And so we see this a lot in the school systems. Also, oftentimes kids get reported to the office, they're written up, suspended, expelled, but are we taking enough time to dig deeper, to explore what is actually happening to this particular child? And so it's not so much what's wrong with you, but it's what happened to you. Let's explore that and let's figure out what can we do to provide the appropriate support and services needed to help that child strive. There are many times on social media, what do we see? We see videos of the individual that may be at a fast food chain that gets irate with the cashier and they're screaming profanity, or they may reach over the counter and grab somebody's neck or throw something. A lot of times, not always, but in a lot of cases, if you explore that individual's history, you may see trauma there. And so based off that trauma, it can have a huge impact on a person's brain architecture and structure and how it's developed. So that area in the brain where many people are able to think through a situation or say, you know what, I'm aggravated, let me walk away and cool off, or let me think this thing through. You have some individuals, they don't have that ability. And so they're accustomed to just reacting. Because like I said, if you have to go home and witness your mom being beat up, you're accustomed to what? Responding. Because you have some kids, they'll go and fight the man, right? And so because you're used to responding, it's more challenging to sit and process and figure out what is it that I need to do. And so it doesn't mean that there's no hope for those individuals. It just means that they need someone to work with them to help them understand what's happening and then teach them social skills, teach them the appropriate tools and practice it so that they can get better at it. And so we live in this society where oftentimes everybody's in this one size fits all approach, right? It's this cookie cut approach. Everybody is supposed to act the same way. And that's not the reality. And so in order to help children thrive, in order to help adults thrive, we need to change our lens and how we view individuals. Because a lot of times it has nothing to do with us. It's about what have they experienced in their life? What does their brain look like? What is the trauma maybe that they have not gotten past? And so I spent a lot of time counseling so many individuals from different walks of life, different levels of socioeconomic status. I've dealt with the people in the NFL. I've dealt with physicians and nurses and teachers. I've dealt with school bus drivers. I dealt with those that are unemployed and waitresses. And what I often see is there's this common thread among many of them. And as I like to call it, it's that unfinished business. There's so much that individuals deal with in their life that they don't address. And I equate it to this avoidance list. And so the more things that we avoid, it creates this backlog and this laundry list in our life, which can cause depression, which can cause anxiety. And so that's why it's so important for us to begin to tackle what's happening in our life, or maybe something that we haven't gotten past, because a lot of decisions that we make is based off of history, is based off of life experiences, is based off of trauma, and we don't even realize it. So let's take a closer look at one of the factors that can determine the effects of maltreatment. It's age. So why should the age of a person at the time of maltreatment have such a powerful effect? It's because the brain develops in a sequence from the most primitive to the most advanced. So let's think about it. Say a tiny baby doesn't need to be able to write a paper or pass a math test, but that baby needs to breathe and eat, regulate their body temperature, sleep, poop, right? Connect with someone that will nurture and protect them. So the parts of the brain that control those internal body functions and that ability to just be able to connect with a caregiver develops the earliest. And those brain regions that control more complex thought processes like writing a paper or solving a, say, math equation, that isn't fully developed until later in childhood. And so as the brain develops, there are sensitive periods for each brain region, where if a person is being exposed to toxic stress while the brain is growing or having those sensitive periods, it can have a huge impact on a person's ability to speak. You see it in some kids. They struggle with saying words. There could be some delays in memory. There can be delays in that part of the brain that helps you be able to stay motivated and plan and carry out tasks. The part of the brain that is responsible for emotional regulation. That's why some people can turn up, right? As they say, they can go from 0 to 100. And we're looking at like, is it that serious? To them, it is. Because their brain is wired differently. So now we're going to look at, talk a little bit about toxic stress. And some of you all may be familiar with this particular term. But toxic stress early in childhood can have a profound effect on the brain structure, the functions that develop later in childhood. And so these functions can affect emotional responses, as we talked about, how people socially interact or their abstract thinking. And so say by the time a person reaches like their mid-late 20s, our central nervous system, with the brain being that command center, it actually orchestrates everything from our automatic body functions like breathing, our heartbeat, to even those complex goal-oriented behaviors and that abstract thinking. And so with stress, it's very important for us to monitor how long individuals are encountering stress. As we talked about earlier, our bodies are only equipped to be under stress for about 20 minutes at a time. And some of you guys may say, well, I'm stressed way longer than 20 minutes. And so if we look at a lot of health studies, it shows the longer a person experiences stress or depression, it actually lowers a person's immune system, which means it makes us be more susceptible to getting illnesses, disease, cancer, being in and out of the hospital. And so it's very important for us, if we're constantly under stress, or if we see kids that we know, whether it be our children or relatives, kids in the community that we work with, to help them. So we've talked about the sensitive developmental periods when the toxic stress has that profound effects on a human development. But these childhood times are also those windows of opportunity for us to build resilience. Because after all, the developing brain is sensitive to all kinds of experiences. So by paying attention to those sensitive developmental periods, we can actually do a better job protecting children and providing the kinds of challenges and support that can correct some of those earlier periods of toxic stress, but also promote a lifelong health and well-being for individuals. So we have a collective choice to provide accommodations and teach skills, connect individuals with the appropriate supports that they need in order to be able to meet those challenges of adversity that they experience. And so if you can remember only one thing about what we talked about today in relations to brain development, I hope it will be that toxic stress can be hardwired into our biology. And so there's a doctor that talks about toxic stress in relations to it's kind of like, and her name is Dr. Burke Harris. She talks about toxic stress can almost be like if an elephant, right? If this big bear comes in your room each and every night, just imagine how that makes you feel. Because if we see a bear, what are we going to do? Some of us, we may run. Some of us may just freeze and just stand there. Our heart may race, we may sweat, the list goes on. And so for these children that are experiencing stress, it's like that bear coming in their room each and every night. And so just imagine if you're under that type of pressure, can you actually study for your tests? Can you complete your homework assignments? Is it easy to function in class? Some can, but some really struggle. And so it's very important for us to be able to explore what's happening to these kids so that we can provide them with the appropriate support. So we've been talking about the effects of toxic stress on individuals. So now we're going to switch gears and talk about the effects of toxic stress on the population as a whole. Most of the prior studies of health and social effects on childhood abuse focus just on a single type of adversity, and that was just sexual abuse. But the ACE study actually broadened the picture to include multiple types of childhood stressors. And so in addition to that, the study measured a wide array of health and social problems. And so the ACE study is very unique because it provides the potential to understand how multiple forms of childhood stressors can affect many important public health problems. The ACE study was designed back in 1991 through the Department of Preventive Medicine in San Diego, California. There were more than 17,000 adult members of Kaiser Health Insurance Plan. They completed a survey about adverse childhood experiences. The survey also included their health behaviors, disease risk and disease, mental health and substance abuse history, health and social problems, and their ages range from 19 to 94 years. In majority of the study participants, they were generally well educated. Most attended college, and there was about 6% that did not have a high school diploma. They were predominantly white middle class individuals that had access to some of the best healthcare in the world. And so those study participants are still being followed today. And so they're being assessed for what is their relationship to ACEs, their cause of death, what type of diseases did they incur? Did they utilize healthcare services? If so, what type, or mental health or substance abuse services? And also their prescription medications that they're using is also being prescribed. The slide that we're looking at here, it shows the 10 categories of adverse childhood experiences that were studied. And so as you can see here in the first column, we're looking at the indicators of household dysfunction. And so that shows growing up with someone in the house that was using substances, whether it be alcohol or drugs. Parents separating, divorce, growing up with someone in a household that was mentally ill, witnessing domestic violence, or having someone that was in your household be incarcerated. And then there are two forms of neglect, emotional and physical, along with abuse, emotional, physical, and sexual. And so as you can see from the percentages on this slide, it shows us that ACEs are common among the middle class, well-educated population. And let's look at what are those highest numbers. We see substance abuse and separation and divorce, and also physical abuse. And as we're going along, you all may have some questions, and so we'll save those questions towards the end, and I'll be able to answer any questions that you have. But I just want to make sure that we get through all of the content so everybody's able to see it, and then I'll definitely get into some conversation with you all. So because adverse childhood experiences are so highly interrelated, it did not make sense just to look at how a single category of ACEs influence health and social problems. But instead, Dr. Anda and Dr. Folletti developed what is known as the ACE score. And so this score is simply a count of the number of categories of ACEs that each person reported, from 0 to 10. And so each category counts as 1 point in the ACE score. So for instance, if a person experienced physical abuse, no matter how many times or what the severity of their abuse, the ACE score is 1. And if the person experienced physical abuse and had a substance abusing parent, the ACE score is 2, and so forth. And so think of the ACE score as a measure of that childhood biological stress dose. So as that ACE score goes up, on average, the exposure to those developmental effects of toxic stress increases. And so in this particular illustration, you can see that only a third of people in the study had an ACE score here of 0. And 16% had 4 or more ACEs, meaning they've been exposed to 4 or more forms of trauma. And so this shows us that adverse childhood experiences are very common. And this data, as we talked about, right, they started this back in 1991. So just imagine what the data would look like today. And so it shows us, too, that this is just a hidden burden in the study population. And so this is something oftentimes that we don't talk enough about or explore. So people who report a higher ACE score are more likely to have health and social problems. In fact, as that ACE score goes up, as we can see indicated on this slide, the percentage of people with health and social problems also goes up. So we actually call this the dose-response relationship. So it's kind of like the more gas you put into a car, the more miles that you can drive. And so in this case, where there is a higher dose of ACEs, there's a higher percentage of people that are experiencing major health conditions. So this slide talks about ACEs, smoking, and lung disease. So let's look at the first set here. And as we can see along the bottom, it indicates what those health conditions are. And then on the left, it describes the percentage of the health problems. So on the far left, we see the percentage of people who became regular cigarette smokers by the age of 12. So as we can see, as the ACE score goes up, what happens? Right? There's definitely a significant increase that we see here. And so in the second set of bars, we see the percentage of those smokers as adults. And we can see that same fashion, right? The higher the ACE score, the higher the likelihood of increased health problems. And so people also with a higher ACE score have an increased risk of developing chronic obstructive pulmonary disease, or what is known as COPD. 4% of people with an ACE score of 0 develop COPD, while more than double that percentage, about 9%, of those with an ACE score of 4 or more developed COPD. So ACEs can lead to that early onset of smoking, which we talked about, that average age being around the age of 12, which can also be sustained throughout that individual's adulthood, which can increase that likelihood of being diagnosed with some type of smoking-related lung disease. So now we can begin to anticipate why ACEs are related to certain behaviors and also social conditions. So here we see the risk of becoming an alcoholic. It increases sixfold from an ACE score of 0 to a score of 6. And ACEs can also affect relationships. And so based off of research, people with higher ACE scores are more likely to marry an alcoholic. And so let's think for a minute about how these factors we're looking at can indicate how ACEs tend to be transmitted from one generation to the next. Depression is considered to be the leading cause of disability in developed countries. So here we see that risk of depression can increase for both men and women in that same dose response fashion. As the ACE score goes up, there's an increase for an individual developing depression. And as we can see, those scores are much higher across the board for the women. So with ACEs are held in the body, and it can lead to mental, physical, and behavioral health problems in adulthood. And so some of these problems are unintentionally handed down to the next generation, like becoming an alcoholic or marrying an alcoholic or suffering from depression. So it's all a part of that intergenerational transmission of adverse childhood experiences. And so I can remember a time I presented to a group of expecting parents. And so with this particular group, at the end of the presentation, I had a grandmother that walked up to me, and she walked up with me with her daughter, and she thanked me for this information. And she said it never dawned on her the impact of trauma and how it was affecting her and her daughters and her children. And she talked about how she suffered from depression, and she was in a domestic violence relationship, and how her daughter was expecting, but she was concerned about her daughter because she was experiencing depression. And so with that conversation, I was able to get her connected to her insurance provider so that she can start getting therapy to address that trauma that had never been dealt with. So here you see a list of some of the health and social problems that's documented by the ACE study publication. And because ACEs have such a powerful impact on many health and social problems, ACE researchers concluded that the ACEs are considered to be the leading cause of health and social problems in our country. So this should make us start thinking about prevention, because we're living in a time with that potential for shifting the trajectory of the health and well-being for generations to come. And so some of the ones highlighted here, we see alcoholism, alcohol abuse, depression and lung disease, heart disease, fetal death, domestic violence, drug use, obesity, mental health related problems, sexual behavior problems, violence, workplace problems, among many others. And so even with this list, you may be thinking about maybe yourself, or it could even be people that you know. You may see a connection between maybe some of the trauma that they experienced and some of the problems we see depicted here on the slide. And so just to recap what we've talked about so far, we know now that ACEs are very common. ACEs are highly interrelated. And ACEs have a cumulative impact that is captured by the ACE score. So people with higher ACE scores are more likely to have multiple health and social problems. So how do we put all this information together in relations to understanding ACEs as just that powerful pathway to health and well-being? Well, now that we understand that ACEs is very common and it can have that strong impact on the risk of health and social problems, we can begin to also look at the impact that it can have on individuals' life as a whole. And so by looking at this slide, it shows us the percentage of various health and social problems that epidemiologists estimate are the causes of ACEs. And so the calculation is commonly used in many public health studies, and they call it, if you're interested, the population attributable risk. And so this is displayed as an oil spill that you see here on the slide. And so it shows us the percentage of a problem is coded by the oil spill. And so it shows us that each problem and the potential risk by preventing ACEs. So say if we can prevent ACEs, it shows us that it can decrease that amount by 54.3% with marijuana use. Look at anxiety, 55.7%. As we can see, these percentages are quite large. Life dissatisfaction, 67.2. Look at how many individuals have disruption at work, where they can impact their work performance or experiencing excessive absences, 61.4%. Suicide, 67%. And then we see factors here like asthma, tobacco use, alcohol and binge drinking. And so it's definitely something for us to think about. And so with the ACE study, it just gives us that straightforward information about the consequences of toxic stress during childhood. And so with this scientific research, it just gives us information that we can use each and every day to improve a person's health or safety, their longevity in life. But the ACE study isn't a particular detailed roadmap of just those services or programs that's needed. And so that's why it's important for us to look at what is that invitation for us just to be pioneers. What are those things that we can do to shift the trajectory of so many people in our community, whether it be our life, our families, community, society as a whole? What can we do to lower those numbers? And so as a society, we have that ability to reach out and connect to others, provide support, as we talked about earlier, not saying what's wrong with you, but what happened to you. Being a listening ear, connecting individuals to services that they may need, spending time doing fun activities, showing a person that they matter, that they're loved. I worked with many social workers, and there's one case that really stood out to me. And with this particular case, it was an individual that was very disruptive at school and would constantly get in trouble. And so the teachers were working with the kid, with the parents, and the social worker. And they really struggled to find what can help this child thrive, because the kid missed a lot of days of school and also smoked marijuana. And so the social worker began to change her lens, and she began to say, you know what? Everybody's focusing on this kid's big behaviors, right? Those disruptive behaviors. Let me begin to look at, who is this child? What are their skills and talents and abilities? What does he like to do? What does he want to be when he grows up? And so she discovered that he had a love for music. And through that, she was able to find programs that were centered around music and the arts. And so the more that this individual got involved in these different activities, and the adults that worked there would encourage and mentor this individual, guess what happened to smoking weed? It decreased. Guess what happened to skipping school and making poor grades? All of that began to shift, because that individual began to do things that they loved to do, and they felt valued. That individual felt seen and important. Felt like, you know what, I have a chance. I see now the essence of me going to school, because if I want to be into the arts and into music, I need to have an education. I need to understand things and concepts and understand money and business. And so a lot of times we focus so much on the behaviors, we're not getting to know this individual. We're not digging deep enough and getting to the core root. And so we have just a few more slides and we will be wrapping up. But relationships and that sense of belonging is so critical in a person's life. Relationships with someone that's caring and just competent, right? It's very vital to a person's recovery and resilience. Having some type of emotional bond or connection can help people weather life's storms. Because at the end of the day, most people want to have that sense of belonging. They want to know that they matter. And so as a community, it's about us having those communities that foster support for individuals. Being there. Do I need to volunteer? Do I need to start a program? Do I need to collaborate with other entities? What can I do based off this information to make a difference? And for some of us, it may just be treating others with respect, having more compassion. And so as a community, it's important for us to look at what ways that as a leadership, how can we expand the work that we're already doing? How can we come together? How can we share experiences to help others? What can we do to focus on producing better outcomes with those that we service? And so the change is up to us. It's shaped by our thoughts, our conversations, the way we relate to one another in relationships, in families, and in also our community. And so we're going to stop here, and I'll turn it over to the moderators so that we can start with some Q&A, and I'll stop sharing my screen.
Excellent job, Ms. Jacobs. We would
Thank you.
like to thank our presenter and the participants for today's session. And if we want to now open the floor for questions at this time, we don't currently see any in the chat box, but if you have any questions, we would like to open the floor for you to ask them.
Yeah, feel free. Any questions that you may have, and also sometimes there may be some questions that you guys just may not feel comfortable with answering. And so I'll put also, if it's okay, you all to put my email. I'll put that in the chat box, and feel free. You can email me as well.
I would also like to use this time to remind each of the participants to complete the session evaluation. Certificates of participation will be emailed within 2 weeks. All evaluations must be completed by the close of business today at 4:30. If you have any certificate questions, feel free to reach out to Chandra DeLone at the iCare office. Our number is 225-226-2273. Do you have any final remarks, Ms. Jacobs?
I just want to certainly, thank iCare, East Baton Rouge Parish for just giving me this platform to share today. I love so much training. I love teaching. I love just communicating with others and just sharing knowledge. And so, as we all often talk about, knowledge is power. And so we're in critical times right now where so many people are suffering. So many people are in pain. And so on so many levels, people are experiencing a lot of trauma during the pandemic. And so even with this information, it shows us that the trauma can have an impact on children. It can have an impact on their well-being. And so it's so important for us as educators, as parents, as individuals that are in the community, caregivers. Some of us have biological, kids, but we can be a parent in the capacity that we help people in the community. And so it's so important for us to check on kids, to ask them, well, how are you doing? How are you coping? Because sometimes we get so consumed with life and adulting that we forget to stop and ask kids, how are they, or what can I do to support you? And so as a big takeaway, I think that is something that is very critical. I started doing that more with clients and also my own child. And so I was amazed with some of the responses. And so based off those responses, it can help us provide more support and care to children during this time. And so I want to thank also the participants for joining in on today. And so I hope this was something that you were able to get something from this that you can use in your life. And so, like I said, if you have any questions or need to reach out, feel free to contact me.
We have 2 questions in the chat. The first one from Alicia. Are CEUs available to LPPs? Yes, ma'am, they are. The next question, what are some recommended therapeutic interventions would you suggest with working with clients with adverse childhood experiences?
Great question. And so in relations to interventions, one I would like to talk about, which is a pretty cool one. It's called Vroom. And let me put that in the chat box. Vroom.org, and let me know if you guys don't see it. But Vroom.org, it's a great website. And what it does is it helps with the brain capacity that we talked about. And so they have exercises that can be used by teachers, parents, clinicians. And so with that information, you can use specific exercise. It tells you all of the supplies that you need. And so it helps with the brain capacity for those that have experienced trauma, and it shows specific to age. That's one recommendation. Another one is Piplo Productions. And so if you guys look up Piplo Productions, and I'll put that in the chat box as well. And I hope it's showing so you guys can see it.
Miss Chantel, can you click on the side? Does your side say comments?
Yeah. Okay.
Yeah, if you click on the comment side, so you can add your email and that site, because they don't see it on their side yet.
I see, and it's not giving me permission to add it for some reason. So let me see if I can, for the sake of time, you guys, let me try to share my screen. Let's do that.
Okay.
And that might help us out. All right, so you guys should see this one. This is Vroom. So this is the Brain Builder. This is a great website. And so I encourage you all to access this. When you get a chance, take a look at it. Very helpful. And so there's information for professionals, but also just caregivers. And so I'm going to stop sharing so I can show you guys the next one. Give me just a moment. And so if you look here, Piplo Productions, this is Dr. Shonda Ghosh. She's phenomenal. She's done a lot of research in relations to trauma in childhood. And she's also an author. And so she's out of UC Berkeley in California. And so she wrote a book, Once Upon a Time. I was very, very scared. And so with this book, if you go to the website, you all, there's also a free PDF. And if you look her up on YouTube, she reads her books, but she has a series of books that address trauma. That's very helpful, not only for youth, but also for parents as well. So I wanted to highlight that also.
Ms. Chantel, can you just share your email address with them as well, if they want to reach out to you to contact you?
Yes, so my email address, you guys can reach me at sjacobs@puremindcounseling.com. sjacobs@puremindcounseling.com, or you can just go to my website, puremindcounseling.com, and it's based in Baton Rouge, Louisiana. And so also in relations to that question, definitely counseling could also be a benefit, but also getting kids actively involved, trying to find out what are their strengths and what are some things that you can get them connected to and engage, whether it be something in the community, something that they can do at home. There's a lot of virtual programs that help kids. I know I've been working with some kids that love art. And so I've been finding programs like on the store Michaels. They have online courses that kids can take. And so just making sure that you find ways to get them connected and involved, and even writing their feelings and journaling is also another helpful technique.
Okay. Well, we want to thank you again, Ms. Jacobs, for your presentation. And we would also like to thank the presenters, the participants again. And if you want more information about Ms. Jacobs, please visit the iCare website, where you'll find more information in her bio. Thank you again for your time.
Thanks.